When you are actually sleeping for a very long time in the prayer bar, I really can remember so many stories, not by other people, but my own stories while I'm riding ocean jet, going to wall, back and forth. There are so many people who are riding who are very noisy, they are talking. When the huge waves na coming, nobody is talking and everyone is praying. I look at them, they were crying. Male, female, all classes of life, all walks, they're all praying. Natawa ko na guna-guna. I was the only one na silent and they told me na, "Uy, ikaw na may wako mga jeep." And I told them, "How did you know?" Diba? So, when the boat finally docked, I don't know if they still pray, thank you, o ba? Anyway, just to remind you, in some points in our lives, regardless of religion, you can contest with this, no? You can question your whatever in your minds. We actually need God. Bahala na mo. Okay, so before I have to proceed po, basing on when ay sa ako na kayo, bakit ko sa very umurban. Well, I was checking your particulars, no, there were a lot, and I noticed na some of you, I don't know if it was really intentional. Many of you, if not one-third, did not write the word confidential in the first leaf. Wala po, so wala gusto lang na confidential, ako may presenter. Isa ba? Okay, so if the moment you will receive it next, because I was planning to return it to you today, but since the result of the block exam is not yet posted, so I'm actually waiting for it na lang. So I decided not to take with me your English. Ibiyan sa ball. Bitaw, I brought them with me. Sa mukha ay may pain yung ticklers na abot sa amo. Abot sa hospital and everywhere, so you go check. And I also noticed that most of you, I don't know if it was intentional or not, did not answer the gender or sex. Why? Then all of you answered blood type, or just one that answered. Abot lang. But for the footprint, brand of footprint, it's supposed to be footprint. Think about when you step on the sands, there would be an impression. Then some of you would like, please allow me to say this now. For example, Onitsuka Brown, size 5.5. The footprint, it's okay with the brand, pero ako ba, the color couldn't be shown on the footprint. Iba na ron ng investigator na that you are wearing Nike Air Black, size 40, pure 45. Nalinaw mo. Anyway, these are things which identify us. Okay, and for your consumption, each question, I am trying to count them. So if you miss one, well, you still have time, no? Please answer them. So if the questions are 3, you have to answer 3 questions, or else for that particular activity, you only have 1. It doesn't need na some of you na one question, one things, back to back. Question number 2, back to back. And I couldn't help myself but react. Some of you, kasi iluwan na lang ko ay, sometimes I reacted like, OMG, or what an interesting story. I couldn't help my hand from reacting, no? Okay, or not siya. So, I'm not talking about points, but these are figures that we're supposed to follow. So, if there are 3 questions, so 3 points. So, if you can count money or points, so that's needed. Na 3, so it's supposed to be 3. Now, at the end of the semester, you would be looking for those. Diba? Mayo mo, pero mabot na 3. Okay, so anyway, we still have more activities. Okay. So what do we have this afternoon? Ayan. Can we have SGD1 to tell us what is it? First game. Where is SGD1? Okay, very good. Claro, magsubuka, you know? This one, imagine yourself if we go out later and then we can meet this guy. Nag-go na dito sa jacket ko, Bolivia. Then this one, and this one is actually, I also do not know about this, but this is what they call as the death band. So for the year, with all of us, we're not yet born. Anyway, so this is the first part of thanatology. So we'll be talking about death. Also, on my time, murag 90% sa akong legal men was about death. So also, our professor cried. I don't have to explain. I know people might be crying now. So first part, because it's gonna be divided into 3 portions para to avoid confusions in your mind, but I am trying to separate the thoughts. So for today's activity or a session, we're just to talk about the simple things of death, the very basic. So thanatology is a forensic term relating to the study of death, as well as its related, the feelings of those who are bereaving, their needs, and as well as the investigation. Okay, so we have this one, legal presumption, of which 90% of you found it confusing when you talk about legal things, at least na ko idea. And definition changes, factors and factor changes. Okay, so let's talk about legal presumptions. Okay, so why is it important that it has to be clearly established that this person is already dead? Very important. Single personality to natural persons. When a person is dead, wala na siya. Maybe we can talk about him, pero his person is already out of the area. Property probably could kill most people. Talking about property, so magpapatay ng pamilya. Death of a partner can kill death to us part. That renders the other partner the freedom to find another one. The death of the either principal or agent is the mode of extinguishment of the agency and the criminal liability of a person. So, if this criminal is already dead, the story ends dead. Pag sorry mo investigate, dead naman. Okay, so let's talk about legal presumption. So, how can we presume that a person is already dead? So, when you say presumption, it's different from when you say this person is being pronounced as clinically dead. Who pronounced clinically dead, it is in the presence of the doctor, the attendance of the doctor pronouncing that this person is actually dead. Presumption, you don't see it, you're just presuming that this happened, but with legal basis. For example, you haven't seen your ex, let's don't talk about ex because mathematics is not our favorite subject. Let's talk about the present. Okay, can you think of a person wherein probably he was your best friend, ex-best friend, boyfriend or girlfriend in your high school years wherein wala na siya lumoko, any news about him, and do you think he is already dead? She is dead already? Namatay na siguro ito, pero kayo ba? Or gilubong sa talim mo. So, especially if you have this particular grudges or resentment about a person. So there is a legal basis about that. If when is it that we can actually say that? So the disputable presumption is that there is a particular length of time when we can presume that that person is already dead. Okay, so for all persons, it is presumed that he is dead in a span of time like 7 years. So in the 7 years, there are already conditions where like let me go back. If uncontradicted, but may be contradicted and overcome by other evidence, okay. Did you hear some stories in Facebook na the father was presumed to be dead like, on an accident while fishing, and then the family received donations from the government and all those things they buried the body, wherein they describe as their father. Like the same description na the t-shirt that he was last wearing, the stripe kuno nga design and all those mga writings. So they buried that person. But after 4 days, their father returned home and was very hungry. So it's because we cannot really presume a person for about 4 days lang. No? So muna siya. So how about the absentee still lives na wala naka-inform? Okay? So it has to be 7 years, but then for the purpose of opening his succession, they still have to wait for 10 years. So in 7 years, he is already presumed dead, but then the family has to still wait for another for 3 years for succession. Okay, so if a certain person is already 75 years old and was never found again, an absence of 5 years shall be sufficient in order that the succession be open. So kung 75 years old, okay, where it's the survival of a person na 75 years old who has been lost, like for sa siguro ganito today, would be very difficult. How about for those people who are armed forces, in danger of death, in other circumstances, on board a vessel, a lost airplane, just 4 years, missing person. So if your ex-boyfriend is an Air Force, you don't see him like more than 4 years, probably you can presume that he is dead. Anyway, that's just an example. Okay, how about survivorship? So if there are 2 persons perish in a certain calamity, like consider the picture in the shipwreck, and then it could not be shown who died first, the survivorship is presumed from the probabilities resulting from the strength and age of the sexes. So let's find it out. For example, what is the presumption of survivorship? Would it favor more of the male or of the young? Okay, let's find out. Okay, SGD 17. If both were under the age of 15 years, and they are both under 15 years, asaan do you think who will have survived? Siya or siya? 17. They were both under the age of 15. It's for SGP 17. Lagi. No question na. 14 years old and this one is 11. So think about siya yung higher chance of survival. Tama? Okay, let's ask SG2. How about if both were above the age of 16? Is that wow, or 16? Tanong mo. Tio na, lolo, tiguang na. This Tio is 65, and this Tia is 63. You mean 63 may mas mo survive. Let's see. Yes, the younger. Okay. SGD 16. If one is under 15 and the other is above 16. Ang mo survive ha, ang choose para ni mo. Ano survive? Kasi tawanan mo. We're good your thought. No. Okay. Okay siya. Kaya makikita sa tao, I don't know, what type of spark is that? So, nasa man? This young one or this one? SGD 16. Namili ka sa mong future? Ang saba. Uy. So you think this one? Let's see. Okay, this one is under the former. May hindi mo mamili ba? Let's have SGD 3. If both be over 15 and under 16 and sexes be different. Ano na lang? Asaan yung ganito We're talking about age here, not the sexes. Over 15 and under 16. Yeah, different sexes. This one. This one. Let's see though. Yeah, the name. Yeah, sir, naman sa iyo na. Okay, if the sexes be the same, it's the older. So, siya na po. Sexes be the same. Kung babae silang mga ba, wala change. These are just presumptions. Okay. How about if one be under 15 or over 16 and the other between those ages? It's how you survive. Please do not give me an answer kung kinsay update mo gawas. Wala tayong i-ask. Under 15 or over 60 and in between. Let's see. It's the latter. In between. Okay. So, by the way, that part there is paragraph 8, if you would really look into that. So, if there is a doubt, actually doubt, between two or more persons who are going to succeed each other as to which of them died first, there were two people going to the fishing, and then we don't know which of them actually survived. So if both of them did not show up, probably both of them did not survive at all. Pero if one would go home and tell the people that he's actually alive, probably the other one who is missing is actually the one who died. Muna siya yan simpler terms. Okay, let's have the definition and concept. So, death is an emotive topic. Termination of life. The word is a complete cessation of all vital functions without possibility of resuscitation. So, even if you resuscitate the person and there is So we have some definition or classification based on the general criteria. So generally, when we talk about death, they are being classified as just this classification. The first one is brain death. So think about a person who is in a deep coma, absence of electrical brain activity, and there are no vital functions. So this person is hooked into an artificial respirator. So think about that. Another classification is a cardiorespiratory death. So sa terms lang, brain death, the brain is dead. Cardiorespiratory, so may dead. It's the heart and the lungs. So we can talk about it physiologically in order to come up with a better understanding. But anyway, okay, it has been said that humans die in stages. Ikaw mo rin about that. That we die in stages, that there is no specific moment of dying. You cannot actually say na this person is dying and still dying and dying and dead. No? But for laymen, they can actually tell na this person is dying because they don't have these classifications. Diba? They don't know about clinical brain death, biological cellular. So as long as the person died, they would say this person is dead. So if the person is still on the moment of dying, which they believe and thought, so they can actually say dying. But for us, soon to be medical doctors, there is really no moment of dying at all. So take a look at this picture. This is clinical. So this is the moment when the doctor would pronounce a person dead, when the family member hasn't yet accepted the truth and probably would tell the doctor, "Doc, our patient is still moving. Maybe you are wrong about this." So when it's brain death, if you look at the patient, if you look at the person is still alive and I'm breathing, though not spontaneously, it has been brought about by artificial respirator, hooked to all artificial things which could sustain his life, but no function at all. And the brain is already dead. And when we say biological death, that is the moment where the family member will actually think about that this person is already dead. The cellular death is this one. Going to the cellular level where the individual cells would eventually die. So meaning, we don't die instantly. No? Now let's talk about clinical death or somatic death. These notes are for you. Okay, I am reducing this into the lowest term. Even though I don't like mathematics. Yeah. When we say clinical, as doctors, or somatic, it's the body. To us, physician, it is clearly visible to our part that this person is already dead. But the thing is, we are to acquire this what we call as the clinical eye. Now, have you heard some stories? There were people who were pronounced as dead, but then they lived. No, na. But there are stories. What do you think? The doctor committed a mistake in pronouncing? Huh? Miracle. Okay, so there will be so many things to debate about, no? Let's find out. So, if you would see a certain monitoring which goes like this, 0 respiration, 0 heart rate, no spontaneous movement, wait, is it still alive? Probably, if there would be there would be some resuscitation which would happen timely. If it's late already, really never revive. So, if the doctor would check on a particular patient and as dead, the family members may not be able to accept that because they can still see some evidences that the person is still alive. Okay? Clinical ones, it's only in the eyes of the doctor using his clinical eye and on his best judgment. So let's talk about brain death. In some states, in some countries, there are so many like they do have this particular laws, they do have some guidelines, but I'm just making a generalized thought for this. So this actually follows what we call as the brain death, which may sometimes be a brain death sometimes may happen ahead of the what we call as the clinical death. Or they can actually overlap. So, what are our indicators to say that this person is already dead? Okay, so there are stages. So, cerebral cortex. Okay, let's go back to your anatomy and physiology. So, you know that this cortex is the highest center of the brain, and it's most sensitive to changes in the supply of oxygen in the blood. So, meaning if there is hypoxia, how much more if it's complete anoxia and it is not being resuscitated, the chance of survival is very slim. Next to that is the cerebellum. It actually follows immediately after the death of the cerebral cortex. But we seldom hear about cerebellar death. What we usually hear is cerebral cortex and the brainstem. The brainstem is even more popular. Did you hear about uncal herniation? So that means the uncus of the brainstem. What the brainstem? What are the parts of the brainstem really? The amygdala, pons. Okay, so these are the centers which are controlling respiration, heart rate, and blood pressure. So in the case of uncal herniation, so when it pertains to, what is that particular foramen, which is very much big? Foramen magnum. So when it descends there, and it's being, what's the back? With some structural things which will not get in. So the person will completely die, even due to the pressure. So if these centers, these are the ones which are controlling respiration, so the person will eventually die. So, isan pa, if the heart and lungs are still functioning, there's still heart rate, the person is still breathing, pero the brainstem is not working, it will eventually stop. It's the control center, the heart rate and respiration. Okay? And this brainstem death is equivalent to legal death. By the way, there is no word considered as illegal death, just legal death. Okay, so here are the criteria for diagnosing brainstem death. So the patient should be in a deep coma, but we have to ask the patient, the relatives, or whoever, mga SO, if this patient is taking antidepressant, is this patient having some other disorders like metabolic disorders or in a state of hypothermia. I really had some experiences with children with hypothermia na mangluog that they don't get inside the house, nagpauwan, nagbasa-basa. Gusto mapabalik ang cellphone nyo, mabalik yung nagpauwan. Hapit, mamatay. No? Because of hypothermia. So, the manifestation of the patient is like the patient is already dead. So, another is the patient must be on artificial respirator. Okay, there is no spontaneous respiration. And there should be a defensible diagnosis. Why do you say defensible? Sometimes doctors could give diagnosis wherein they could not really defend. For example, the patient came in for fever, no fever, just vomiting and no fever. And the admitted diagnosis is systemic viral infection. It's very operates from ruptured cerebral aneurysms, which are getting common these days now. The patient is apparently well, mukalibang into a deep coma, so that's one among those. In a diagnostic test for brainstem damage must be unequivocally positive as determined by the doctors. This, we could have a certain problem if they would require the EEG. Okay? Not all hospitals have the EEG. Basta, two doctors could really tell na, sa akong tanaw-tanaw, brain dead name. Okay, let's talk about persistent vegetative state. So, SGD5. Wala, I just mentioned SGD5. Think about with a certain irreversible destruction of the cortex, it actually occurs, but then there is no damage to the vital centers. Think about that. What will happen to a patient? Look at this patient. This person, maybe rest in peace now. So there is already a destruction of the cortex, but the vital centers are still intact. Meaning, alive, di ba? Also ba? You think this particular description describes a person who is already dead or still alive? Alive pa. In fact, he can even open his eyes. Open his eyes, but then alive but not kicking. Alive pero lutaw. Sa may alive ang mata din pero lutaw. Open ang eyes. So the patient is not comatose. He is awake but unaware. Hindi sa may awake dira but unaware. And I tell you, the recovery is remote. You can actually read the case of Lampert versus France. So he is actually a French psychiatric nurse. No? At a young age, he had an accident with a motorbike, no? Which made him quadriplegic. Okay, so to make the story very simple, he was in a state of coma and paralysis. But then they noticed that sometimes he opened his eyes. But it's been a while, almost 8 years, going to 11 years already into that particular state. So he is hooked into a respirator, an artificial respirator, and he is being fed, not through the mouth, but with the use of, basta everything is artificial. So the family, as was described in the case, were should I say, Catholics. So they really opted for the survival of this patient. Bahala now, gaana siya. But then it was said that the doctors decided for the patient. So if you are interested into this case, remember it's in France. If you can still remember in our topic in ethics regarding euthanasia, is it allowed in France? No, what? The doctors and then. If the doctors would decide that this patient is not anymore not needed in the society, so the treatment is considered to be futile already, and they can stop. So it was very debatable at the time. So if you're interested, you can go and look for it, read about it. In my view, it will also come out in the exam, diba? So we have this Harvard criteria of a whole brain death. So the first one is unreceptivity or unresponsivity. So if I ask you and you don't respond, that's unresponsivity. Unreceptivity. So total unawareness of externally applied stimuli, no matter what you do, mga noxious stimuli, pasakitan o mayo, lang ihapon. No? Another is no spontaneous movement or breathing. What does it mean to wow! Bisa natin wala niyo sa doctor or siya. Okay, if you do some testing for the reflex system, wala gihapon, okay, that's it. This is intended reflex, not EEG, not ECG, not EEG of confirmatory value. So this is the problem. Not ECG, the ECG, it's not anymore brain death, it's cardiorespiratory death. Diba? Flat line na ECG. So, as I've been telling you, this is a problem because not all hospitals have the EEG machine. Okay, it is recommended in order to confirm by people, are you trying to confirm EEG of a live person? No EEG is taken at least 24 hours apart to document the absence of cortical and critical activity. Okay, so we also have to take into consideration that this patient has been exposed to extreme cold, and other metabolic conditions. Okay, so when the brain has seasonal functions, again, even though the heart continues to beat, that's brain dead. That's brain death already. So again, doctors specifically, not just one doctor, it has to be at least 2 doctors that they would legally declare whole brain death 12 hours after they have corrected all treatable medical problems. Okay? Wala na siya reaction to pain, hindi na mo react to light, scan mo no reaction to light and accumulation, no spontaneous breathing. However, the person could still have some reflexes if the spinal cord is still functioning. Now let's talk about biological death. I can declare actually, this is very clear. All the components of the brain are dead. What else? The evidence of death is gross. Wala na siya mo reklamo. Even an ordinary layman, di ko na siya dead na siya. This is what the people, mga laymen, could tell na dead na. But again, on our part, it has to be clinical death. Pag-wait pa mo biologically dead in yung patient, as a pamawingon of pronounced biologically dead. Hindi naman clinical, di ba? When you write the order on the circumstances of death, you have to write there like epinephrine given, the drug doses, and so on and so forth. And the last part there is pronounced clinically dead. So, if don't claim mo, so pronounced biologically dead, or ako lang trained, wala ma-educate as a doctor. The cellular death, it's already on the cell level. So, the cessation of respiration and metabolism goes into the tissues of the body, hindi kayo the individual person. So, it's going down to the cell and the function of that is permanently stopped already. However, since there are differences in the composition of the cells, the death of the different parts of the body occurs at different times and stages. And this is the same reason why before this type of death, if ever there should be harvesting of organs like cornea, kidneys, that is the time that we can actually do that. Okay? Still preserve pa man. If you go beyond that time, the success is getting slim. So, how about the WBC? It is said that it can remain mobile for at least 12 hours after cardiac arrest. So, pwede mo makakuha pa blood. The nervous tissue, however, we have known that is very vulnerable to hypoxia. The neurons will die only after 3 to 7 minutes of complete anoxia. That's the thing that we really have to remember in cases of asphyxia, mga hanging, circulation, drowning. It's only 2 to 5 minutes. So, what is ang golden time? It's because of the vulnerability of the nervous tissue to hypoxia. siya. So about apoptosis? We really love that subject na Gen Pop. Diba? Apoptosis is, di ba, Master Bali? Program cell death. Di ba, may money. Morphologically, there is a cell injury where the body will try to eliminate the unwanted host cells through a certain process. So it has been said the program cell death, it's like the computer is being programmed. This is not needed anymore, so the body has to get rid of that. Yes, no? How about this near-death experience? Okay, this here are descriptions of this. It's getting creepy, okay, anybody of you, particularly ito yung Junako, some people are very sensitive to number 13. Some hotels actually don't have a 13th floor. No? I was actually alone riding the elevator. At least milestone achieved. SGD 13. Any one of you who has experienced NDE? Asa ba ng SGD 13? Dara. Ikaw dear, wala? How about you? Anybody from SGD 13 who experienced NDE or near-death experience? I can see your eyes are looking at the screen. Ano naman? Wala actually in class. Nobody in this class experienced NDE. Who would like to share to the class what happened? Wala? Reza? You have? Anyway, as it is near-death gani, so the person is not dead. Near-death now, so, but have you experienced some forms of like, detachment from the body? They mag-post, mag-love na. The detachment niya ang soul siyang body niya. Have you experienced? People at the back, have you experienced levitation? Did you? Have you? Levitation, lagi kini. And then, someone's raising his hand. Hindi mo kayo kumang laro si Aya. Layo na kayo, I can hardly see raising hand. Si Cromwell, hindi maglaro. Very far. Just in case you already have experience of levitation or also the presence of light. Wala. So this phenomenon actually happened to some people who experience near-death situations where they were once pronounced dead. Pero it's a prank. It's a prank. Like that. Okay. And surprisingly, it may originate from not life-threatening events. So pwede lang from extreme na mga fears or usang, and then you feel like your head is already out of your body, your soul is already out. And some even would have this narration na they are sleeping, they are lying down, and they can feel that their body is going up, standing and going outside, and they could hardly go back to their bodies. Some people would have this one, and they actually were dreaming. And some would tell us like they became a witch. You know, they actually experienced flying, and when they wanted to go back to their bodies, they could hardly do it. You didn't hear about these stories? You probably you never went to those far-flung areas. There are lots of stories like that. Anyway, some people will say that these are actually evidences of the afterlife. And some would say that person is like paranormal. I don't know. So it's for yourself. Do you think it's an evidence of afterlife or you are a paranormal? Okay. We'll make the team without. So let's talk about signs of death. So these are the signs: cessation of heart action and circulation, lyrodementia. So in a period of 5 minutes, it's considered as certain. But you know, when a person is very rich, I have experienced that in one of the private hospitals here in Cebu. The person was already pronounced 30 minutes ago, but then the wife still asked us to resuscitate. Was still 30 minutes more. No, it's very certain already. It's more than 5 minutes. Cessation of respiration has to be continuous and persistent. Okay, let me ask you, can you hold your breath? Okay, hold your breath now. 1, 2, 3, go. Hold your breath. And let me see who survives. That is not intentional also. That's not murder because you were able to defend for yourself. You could not hold your breath longer than 3 to 5 minutes. Like there are so many stories about lovers quarrel. They tried to make, this is in Cebuano, they say you don't, it's not true. At the moment you are reaching that part there, your body will tell you to breathe again. Who would do that? No? If you are lost for your gasping for breath, now your body will automatically help you to breathe in again. Diba? So, cooling of the body is under this, and that is the cold temperature of 15 to 20 degrees Fahrenheit. So, as you may notice, the dead persons are very cold now. What else? Loss of motor power, loss of sensory power, and there are changes in the skin. The skin of the dead doesn't look like the living. They are pale, they are waxy, because of the absence of circulation. How about in the eye? Have you tried doing this when you see the dead? Have you afforded yourself doing that, checking on the eyes of the patient who are already dead? No. You're not scared? You tried this. You can see this one. So you're supposed to say this. Since these are French words, so you pronounce this as Frenchman. Tache noire, long laster. So tache noire, this is an oval or triangular spot. So this is how it looks like. So if there are dead patients who try to look into their eyes, and you can see this. Ang handlong ba, when you open the eyes and check the word this tache noire, and the patient will say, Bulaga! Or surprise! Okay. So, there are methods of detecting a cessation of heart connection and circulation. So, SGD6, how do you palpate for the pulses? Anybody from SGD6? Someone, where are your pulses? Where else? Okay, you're supposed to know all of them. So when you see a person, you think if this person is still alive or dead, which particular pulses would you check? Dili kayo femoral? Nagrabi ko buwan pag sa carotid. Okay. Auscultation of the heart sound in the precordial area. If you have the stethoscope, diba? If you don't have, what's the man? You just have to palpate using your hands. What else? Fluoroscopic examination that is already using a guide. Look at guide. The way we say Clarion is dead. The use of ECG. So if you can see a flat line, you still question if this person is still alive. Okay, it's a crooked line. So these are just fingers, probably the result of epinephrine, which which is not enough to evoke certain impulse. What else? The Magnus test. SG12 doping. Do you have a tie or any ribbon? 90 na lang, 90. Punta ka SG12. Okay. Okay. Red ribbon. Birthday? Ay, believe na happy birthday. Basta mo itong flower. Okay. Wow. And now, the next is, please have to keep that. If you have any, is it always right? Their request, who is that person? Basta na yung specific person, who is that person? Yung real classmate. Okay, I would like to request Mr. Iligan to please come up. Perform the Magnus test on Ryan. Magnus test. Bantay bitaw, limot po. So, in the fan, there is no change in color. So, di ba, like pa si Ryo, clear kayo, the area where the negative is applied is not the same as the color kay live fan. Okay, the red person, no change in color. Opening the small artery, as in, you really have to do that. Kung pa sa kitan, like Earth's test, you use a dye method, injection. So if you inject it, the solution will just remain in the site of injection because there is already loss of circulation. Mapagin sila ng mobile sa ilang circulation. Leigh's test. Have you tried as a child using a flashlight? When yes, that one on the side. You do switch off the board. Oh, switch off the board. Okay, so it's in the figure with webs. On the living person, it's supposed to show pinkish or like orange. In the dead person, it would appear yellow or another thing. Stuck on a confused. Okay, so how do we test the test for detecting the cessation of respiration? Expose the chest and abdomen and observe the movement during inspiration and expiration. Okay, do not completely expose yourself. So you just check on yourself. Diba? You can actually see the movement when you inhale and exhale. Diba, if you're thinking, if you see a person lying down, and then you will think, okay, pababa ni. You clearly would observe if there is movement of the chest, diba? If dugay tayo move ang chest, then you would think, namatay ko dati. Diba? So that's one. Examine the person with the aid of stethoscope. Examine with the mirror. What with the mirror? You girls here, ladies, you have mirrors, right? So when you look at the mirror and you breathe into the mirror, there is a mist. And you're alive man. Feather or cotton fibers, for example, it has to move. Ipanuli mo sa or sa nose, yeah, it moves. For a glass of water, may mo perform or yan. You would usually do like this. If you get a glass of water and then you place it on the chest of the person that you're to examine, then if there is no movement, so that person has no respiration. And how about this Winslow's test? So for example, this is dark, you already know. This is dark, so if I stay here and there is my shadow, like I'm reading, you can see the shadow that is moving, so that's Winslow's test. Shadow na siya silhouette na showing movement. Okay. Changes in the body following death. Okay. We have some changes in the muscle. So we have 3 changes. The first one is the stage of primary flaccidity. So as the person dies, this is the first stage. That is why when you see a person dead, not immediately the body becomes rigid and disciplined. Diba? Some family members would say na, uwi ko man na siya, yung mainit ko magani. Alam na nalagay mo, resort ko, no. And then the body would not immediately go to the state of rigidity. It has to go through this process. So flaccidity. So here, for you to easily remember the primary flaccidity stage is that the sphincters are relaxed. When you check on the pupils, they are dilated. Creepy kayo siya when you look at the pupils are dilated, nabago kayo siya. It's like when you see a cat, the pupil of a cat which is very big. It's like that. The sphincters are relaxed. You could really appreciate that this person already urinated. If you see some people na may particular accident niya, they have this incontinence in urination or nakalibang, then think about the person is already dead. Okay? Vaccine naman. No more control of the sphincters. Then followed by the very rigidity. So this is when the whole body becomes rigid. And this usually develops like as early as 3 hours and as long as 36 hours already. So this is what the layman would call as moving dead phenomenon. Because if you look at the body would seem to be moving because of the rigidity. This can actually be utilized to approximate the length of time the body has been dead. So if you can see a person dead and there is already rigidity, think about use this knowledge now using probably it's like 3 hours or more. Okay? So did you na siya post mo sa Facebook na now lang yun ni ito. if the body is already rigid. Okay? Stage of secondary flexibility. So this is where pulmonary function is already commencing. So the muscles are no longer capable of responding to mechanical or electrical stimulus. Unlike the first stage wherein the body will still respond. Okay, let's talk about cadaveric spasm. In my time, all uses cubic body. Making it simple, so that is a certain instantaneous spasm of the muscles which happen at the moment of death. But I tell you, it does not always occur. Dili siya, all dead person would have this experience. No, it's only for those cases wherein there was exhaustion, tension, fear, or even injury to the motor nerves, or blood, chest trauma. Okay, so the importance of cadaveric spasm is if you see a person dead and they say that this person is being shot or this person is committing a suicide, you can use this. So if you can still see the weapon at the head of the victim who was allegedly killed himself, that particular instrument will still be held in the hand of the dead person. So that is what we call as cadaveric spasm. And it would be very difficult for the other people to remove that one. So if you can see some movies or events which really happen in real life situations wherein the instrument is actually planted it's difficult. Okay? If it's not cadaveric spasm and you hold on the gun can be easily removed from the hand of the victim. So meaning, it was actually planted. When that gun was placed there, the person is already dead. Pero you will never know if he was shot and then the victim is still alive and the gun was planted. Okay? So, problema na sa investigator. What else? So what if the victim is, there was a story na from flood, there is a recovered dead body, still holding mga gamot or salina. So that would tell us that if this victim had a struggle prior to his death. And then it could also tell us that this victim was still alive before he ultimately died in the water. Because he is already dead and being thrown into the water. So that's a quick story. Okay, for your convenience, we can actually distinguish rigor mortis from that of cadaveric spasm. As I've been telling you, the cadaveric spasm, we cannot say that it happens to all dead person. Unlike the rigor mortis, where it is really of natural phenomenon. So, what is the implication for this? Rigor mortis can be used to date or approximate the duration this patient has been dead. Like, if we can see the very rigidity or rigor mortis, we can say this person has been dead like 3 to 6 hours. Okay? But the cadaveric spasm, we cannot always see that. However, it will tell us the nature of the crime, whether it's a suicide or a homicide. So there are also changes in the blood, the coagulation. So we don't just think like it coagulates or that takes here, like how long will the blood coagulate, for how many minutes. Yes, but however, it may remain fluid in the blood vessel for up to 6 to 8 hours. Then, this one is showing us postmortem durability. So, it happens because of the gravity of the most dependent part of the body, and it does not change. Hindi mo man nalisuon, naragin siya gapon din na. So, if the body is lying on that, laterally because of the left body, and you can see there, and then there is the it doesn't change now when it's already there. Okay, now let's talk about autolytic or autodigestive changes in your diet. So, gradual intakes of proteins, fats, and lipid, fermentation of the tissues. So, combination of resident subject, no? So, the complex proteins, they are to be broken down into simpler components, but not just that. So, when they are being broken down, they are usually associated with a foul-smelling gas, and it will be accompanied by the change of color in the body. So, this foul-smelling gas will cause the distension of the abdomen with bloating of the whole body. I hope you since birth wala pa mong tao, dead body na is like that, there is already bloating. So the eyes and tongue may protrude, and there would be marbleization. So this is specifically true with people with fair complexion, wherein the superficial veins are very prominent. So hindi siya appreciated to those with dark skin. So we have kinds of putrefaction, mummification. Mas nagkanan ng mga figure. So there is a way of preservation. So due to the evaporation of the body of the tissue fluid, the body is being preserved. So have you heard sa mga Egyptians, the physical appearance are being preserved? Actually, as to the books, they are just they undergo with real changes, and probably the hair could still be intact. Maceration. So when you say maceration, think about a certain body which is in a fluid medium. I'm giving you an example of a macerated fetus. Yung igawas, it would really look like this, no? It's reddish or greenish. So it would tell you na this is already dead inside the uterus. Then we have saponification or adipocere formation. So think about sabons. Sabon, diba? So it's waxy, rancid, or moldy material product laying waxy lang. So it actually delays the decomposition of the body, and if you touch it, it's of course oily. So there are factors and putrefactive changes that we are to talk about before we're going there. So after burial, so think about like the effect of the coffin. So mahalon nga coffin or barakuton. The depth where it is being buried, the clothing. There are other family members who would have this idea na babaon, mas dali manikumpos kung dagat kay karga. The condition and type of soil, access of air to the body, or if it's in mass grave, then if there's a trauma of the body, it makes decomposition faster. Okay, so there are also factors to consider in approximating the duration of death in cadaver. We all experience noticing these flies, di ba? Isa may wapakakita fly in his entire life. There are lots of flies here in Cebu City. So, why do we have to talk about these flies? No? They can actually help us. So, there is a certain life cycle of a fly. So, before a fly can fly, it passed through the stages like it's from the egg. So, yeah. So, that time, it takes 24 hours for the fly's egg to be hatched. Again, it's 24 hours. So if you see the presence of maggots in this is cadaver, it indicates that this cadaver has been dead for more than 24 hours. Basta kita mo maggots. So hindi kay now ang shooting namatay, yan na yung maggots. Okay, what else? Light fleas in the clothing. So accordingly, a flea can survive for about 24 hours when it's submerged in water. So after that, matay good food siya. So if the flea is still alive, what can you say? It's less than 24 hours. Nilutaw ang body, you have flea diya, no? So do not clean it immediately would be able to recover a dead body, we're not clean immediately. Look for the flies, the presence of maggots, if there are, and the flakes. So blood vessel clots, if you can see there are not in blood, think about that this is like 6 to 8 hours already. Then the post-mortem debility, we have just mentioned this one, and the rigor mortis, which could start as early as 3 hours. So the rigor mortis nga, now lang. This would actually help us. How about when we say a doctor, especially mga MHOs, they are fond of writing already on the stage of decomposition. So meaning, pagkakita nila, death already took place about 24 to 48 hours. And if you really would like to know, if you apply pressure on the skin, you can actually appreciate crepitation. So if you want to know that, okay, you try doing that. But you have to wear gloves, okay? You will fingerprint. Don't need impression. Food in the stomach. So if one or an investigator would be able to recover a dead body wherein there are presence of food in the stomach, think about that. So it is said that a medium-sized meal will usually take like 3 to 4 hours. Medium-sized family, then a heavy meal to be completely full from the stomach to the food we know. So kung liquids lang, very fast, no? But vegetables may require more time for gastric digestion. So if you could see this, the presence of the food in the stomach, so think about this person has been dead like, so what, 3 hours? And how about the skeletal soft tissues? So it has been said that it may disappear like 1.5 to 2 years after burial. So in cases wherein our their loved ones would be transferred, and if you it's like exhumation and it's happening, if you see that it's actually a skeleton na. Okay, would you expect soft tissues are still present? Diba? You will know the next topic. For how long will it be legally? Will we be allowed legally to transfer the body or to reopen the body? So the body is said to be skeletonized in a span of like as early as 1 month. So for your convenience, we have here a chronological sequence of pressure factor changes which is occurring in tropical region in the Philippines. So in other countries, maybe it takes longer, no? So again, if you see abdomen which is distended with gases, consider the dead body has been dead for 24 hours. How about if you see maggots? A more than 24 hours man, it shouldn't be 24 hours. So may answer na 28 hours acceptable. A more than 24 hours man. So see, it's like 1 month, the body is already skeletonized. How about if it's submerged in water? When would you see when the face is swollen and red? So that's the usual when dead bodies are being recovered. It's usually like these days, or mga rigor mortis pa are seen. But if ever you would see like skin of hands and feet come off with nails like a glove, so it's already like a month or at least 4 weeks, because months could vary from like 4 weeks or more. Okay, so before we have to think about anything, let's try to think how long has this body been dead, like this one. Clara, right? Bago-bago like now lang. I can see the abdomen is bloated. How about you? Can you see that? So how long na ni dead? Oh? 1 week na, may lawas. Ay, ikaw na nasa ito. Okay, so floated then that's like 24 hours, diba? How about therapy? This could be years na no, nabungkal. Pero it's intact, kunyan, ang skeleton kay forma pa, like as early as 1 month. Hindi ka nagkapit na ginakal na siro. How about this one? How lang? Ako ikapon if it's cold or warm, no, if it's not rigor. How about this one? There are flies. It's not more than 24 hours or 48 hours. Okay. Okay, so for the references, here's our personal one. Okay, please look at the schedule for an interview. Let's see kung bago the exam. How about this one? It's new if they don't be declared as an artist naman. We don't know. So based on the guidelines that we have, when it falls on a holiday, you don't have to like stress it. I will just give you the topic. So alam mo siya. So no assessment if ever it's basta take note, no assessment sa iyo na nagyakan, no? This one, lain-lain. How na ba? This one, no? Assessment of this one. At least you can prepare. And for your activity 2, I hope you will enjoy it. Alright, no need to write anything on your tickler. Wala you write. Now for a movie, you just yes. No need to write something on your ticklers. Your ticklers are still in my still in Lumpia. No need to write something on your tickler. No need to submit anything. You just have to watch it. But of course, this will be part of the exam. You just have to watch it. Namoy bilog-bilog ka. Huh? It's just scary, I tell you. It's not more of horror, it's more of love story gone wrong. So, basta, you need to watch this movie, you need to watch. Hindi ko masulti. Basta, it's about death. Wala dyan nila, it's about death. You can appreciate our lesson. Wala sa'yo mo. We'll see. Questions, clarifications? Please rise.
Let's pray. Father, in the Son, and the Holy Spirit. Thank you, Lord, for this day. Just watch over us as we leave and keep us safe